Welcome back to another episode of HealthU Watch, brought to you by Alaska Regional Hospital. We are here at Sunshine Community Health Center speaking with Dr. Crozel, and she's going to tell us a little bit about what the health center does here in Wasilla and where their locations are and a little bit about what they do.
Hi, thanks. I am Dr. Crozel. We are at Sunshine Community Health Clinic is a community health center originally based in Talkeetna, also has places in Willow, and recently we added Wasilla in December of 2020. And we're full spectrum, cover primary care, pediatrics, dental, behavioral health. I think that covers everything.
Cool.
Yep.
And I know you guys do some things on the, it's called obstetrics, is that correct? Can you talk a little bit about what obstetrics is for our viewers and kind of explain what that means?
Sure. So obstetrics is the care of pregnant women from even prenatal, prior to conception counseling, early pregnancy care when women are just barely pregnant, all the way through their pregnancy, including their delivery, and then postpartum care as well. So it covers the full spectrum of care. Okay, so it kind of combines the OB doctor and the pediatrician into one, and then carries beyond childhood. Is that correct? So am I describing that right? Sure. For family docs, so I'm a family doctor that does obstetrics, and so I do care for that full spectrum of patient, including the care of the baby, the newborn, and also children into adolescence and adulthood. Obstetrical care you can obtain from an OBGYN, who's an obstetric gynecologist, or a family medicine doc who does OB, like myself, or even some people choose to get their care from midwifery, either certified nurse midwife or direct entry-level midwife. So there are a variety of ways that you can get obstetrical care. Okay, and so what are some of the advantages for the women considering or families considering getting pregnant or who are pregnant right now? What are some of the advantages that you would explain of obstetrics in using that? So I think that what I feel like I do best is knowing the patient. Often I have had a long relationship with that family, many times knowing them prior to getting pregnant, maybe knowing their medical history, their family history, often seeing their siblings or the siblings of that child, also the partner, that I also may be the primary care provider for that partner. So knowing that family unit I think is really helpful in terms of how we guide their care, and also the trust relationship I think that develops too over time. One of the big things that as I was training, when I was trying to figure out what I wanted to do as an OBGYN, oftentimes once the baby's delivered, they're sort of done, and I was always like, wait, where's the baby going? Like, I want to take care of that baby too. Yeah. And so I get to take care of the baby. Oftentimes, within a week of discharge after having a baby at the hospital, baby's back in the office, and I get to see the baby and the mom all at the same time, even if maybe that appointment's for the baby. The bonus is that I can address whatever issue might be happening with mom at that time too. You get a lot of information as well when mom and dad are in together, when they bring the siblings in, and the dynamics and what's sort of happening in the room. Also maybe what their struggles are, what they're having issues with over time. So I think that's super helpful. Sounds like a real holistic approach to like family care. You can kind of see everybody and address everybody, and not just individuals at different ages, and those things don't matter as much. Right. Yeah. The lines are blurred for sure, but I think that's part of the benefit for sure. That's great. Dr. Crozel, I understand you guys have an upcoming event for families. Can you talk a little bit about that event? So in January, we're starting a mindful parenting class. And I think that the goal would be to do some education, and also sometimes in settings like that you learn from other people as well, right? So some support group type settings. And my understanding is that it is there would be no cost to the patient. There would be a billable service through insurance if their insurance covers that, but if not, then there would be no copay or deductible.
Cool. And if somebody wants to find out more about what Sunshine Health Community Health Center does, where would you recommend them going?
Our website would be good. It talks about all of our services. You can look at our dental providers, our behavioral health providers, our primary care providers, and get a ton of information from the website.
Yeah, I understand the website has a ton of content around parenting and obstetrics and that kind of stuff. So that's fantastic. So make sure you guys go there. All right, guys. So if you guys go to the link in the caption, you'll click that link and there's a secret code in this video. You're going to enter that secret code on the landing page to be entered to win special prizes. So make sure you guys do that. Now, Dr. Krasel, thank you so much for joining us today.
My pleasure.
Sunshine Community Health Center. If you want to leave our listeners with one last thing, is there anything you'd like to leave them with about what you guys do here and what's close to your heart?
I think it would be to seek out good primary care, call your doctor, get an appointment. Prenatal care really matters. It matters for the health and well-being of your baby and your family, and it's really important for your health. So that's what I would say.
Thank you so much. So if you are a family thinking about getting pregnant, or you have pregnancy coming up, and you're looking to get more information about obstetrics, make sure you guys go to the Sunshine Community Health website. Thank you again for tuning in to the HealthU Watch, brought to you by Alaska Regional Hospital. Thanks, everybody. See you next time.